Okay, everyone, I am so excited. I have a little bit of a crush on this next guest, Margaret. I have known Margaret. I don't even know where are we at now. Are we at 15
Oh,
years,
oh, I think
13 years?
more.
Oh my
No, I
gosh.
think more. We're getting old, Deb. We're getting
Oh,
old.
goodness. Well, it's been an honor and a blessing to be in your village and for you to be in mine. Such a good friend and colleague. And I love that we can call on you for support, guidance, and education. So thanks so much for joining in today, Margaret.
Are you kidding? You know how much I love collaborating with you and, of course, being better together as one so we can help more new parents. It's what it's all
Amazing.
about.
Amazing. Well, thank you. I'm so excited to have everyone here in and watch in on everything you're going to be sharing today. But before we start, you are such an incredible woman and you have so many different things under your belt. So can you wow us with a little bit about Marg? Tell us who you are, what you
Sure.
do.
Of course. So my name's Margaret Wallis-Duffy, and I'm the owner of Wallis for Wellness, an award-winning integrative health and massage therapy clinic that's been in operation for 29 years. I have a background in kinesiology from the University of Waterloo. My postgrad is in massage therapy. I'm internationally certified with infants and special needs babies. I've completed a couple of research workshops at the Jackson Medical Center, the University of Miami, and really for the better part of 3 decades, one of my passions is to educate, empower, and inspire people from pregnancy through to palliative care to live well. I have a passion for preventative medicine because of my own health journey and knowing how important it is to have conventional and complementary medical professionals working together, but most importantly, to put the patient, you and I, at the center of that equation. And you know what? So I have a learning academy because education matters to me. I do a lot of media, and I'm a mom of 2 great growing kids, and really love to be able to share education like this.
I'm so glad. You're also one of the faculty on the perinatal support
How
worker.
could I forget that? How could I forget
So
that?
many things. It's hard to remember. I'm really excited because we're talking today about something that a lot of parents don't think about. And this is how massage can really help a lot of these ailments that your babies are suffering through. So, healing touch, comforting touch for your baby who might be going through some health issues in the first, or maybe not even health issues, but some issues in the first few weeks or few months of life. So let's start with that. Can you share a couple of common concerns that you've seen parents complain about that we would never really think to go to a massage therapist for?
Absolutely. And I think first we need to say, Deb, that baby massage has been well documented in science. It's been studied. But what I love about it the most, it's a parent empowering program. And that's why I love it. I love that I can show a mama or a daddy or a grandma what to do with the baby. Then they get to go home and have an impact on the growth, health, and development of their baby. So you might just think, oh, it sounds nice and a little massage at bedtime. And yes, it's bonding. Absolutely. All of those things are true. But did you know that it can actually have an impact on the growth and development? Did you know that it can improve proprioception? Did you know that it can help with gas and colic? I have pediatricians referring to me for treatment of gas and colic, and I mean severe issues. Um, teething pain. You don't have to be walking the floors, pulling your hair out at night with a baby screaming. Their touch is very, very powerful. And there's a lot we can do both outside and inside the mouth to help relieve pain and to reduce stress both on the baby and on mommy. Prevention of flathead, or otherwise known as plagiocephaly. That I'm on a crusade to stop that and to increase awareness, because when we have knowledge, we can prevent your baby potentially from having to have a helmet on its head. And just recently, I had a live example of that in my clinic. And how rewarding is it to watch a parent be involved in the care of their baby, see the power of touch, and now this baby doesn't have to have a helmet on. So there's all kinds of things. Sleep, we could go on, and you certainly know the impact of massage on sleep in
For
babies.
sure. Well, this is why, as a sleep consultant and perinatal support worker faculty, I'm working hands-on with parents. You're my go-to because there's so many things that touch one topic. With teething,
Yeah.
you can do massage, you can give, therapeutic medicines that might help. There's so many things, even knowing how to diagnose it. So some parents don't know these things, and that's what you and I have shared over the years, is really filling their parenting toolkit with all of these different
Yes.
things. It doesn't just have to be go to your doctor, get medication, come home, and then still
No,
suffer.
100%. And you know what else I didn't say, which is so, so important. And I get feedback from thousands of parents over the years. And that is this: that touch is the first, their first way to communicate. Before they can speak, they have body language. But here's the problem. A lot of parents don't know how to read that body language. How would you? This is all new to you. And in fact, every baby can be slightly different, but there's some commonalities in body language that massage and touch can help you understand, so that you can figure out what's your baby trying to tell you, and then have a plan of how to react to it, so that you can help them through times of trouble, or to just improve their overall health and well-being, and make them aware of their bodies at a very young age, so that they're going to be healthy adults in the future.
I love that. Well, thank you so much. I'm going to put you on the hot seat and ask you for some tips.
Okay.
Because again, we want to give them some of these tools while they're listening and watching. So first off, one of the common ailments or concerns parents are struggling with is baby gas or colic.
Okay.
So help us,
Yep.
For these parents who are struggling. We talk about the bewitching hour, and sometimes parents are like, why is 5 to 10 so bad? And I know that they get tired by the end of the day. They're starting to get a bit restless, but you've always shared that, be proactive and don't let them be backed up.
Yeah.
So touch on gas and colic.
Gas and colic. You've been up all night helping a mom, so I'm going to give you a pass on that. Gas and colic. And you know what? That's one of the main reasons I get referrals, is parents are struggling. Babies are screaming with gas, even if they don't have colic and they don't know what to do. And it's hard to watch your baby in pain. And like you said, just waiting till things are broken or waiting till a baby is screaming is not ideal. I'm all about preventative health. What can we do to prevent things from happening? Well, I got to tell you that the gut in our babies, there are little finger-like projections inside all of our intestine that are supposed to move in a wave-like pattern called peristalsis. And that wave-like pattern coerces gas through the intestine in a clockwise direction. Now, when you fed your baby all day long, and those little finger-like projections are sluggish often, and certainly in lower birth weight babies, it's even more, but even in a robust full-term baby, that can be really sluggish. And so then as you fed your baby all day long, you can set your watch, 7 o'clock, the baby's screaming, you're pulling your hair out and you're walking the floors till 11 o'clock at night, exhausted. But what if you could actually do some abdominal massage? And there are many strokes that you can do preventatively at every diaper change, where you're going to do a couple of strokes like water wheel and sun and moon, where you're going to actually keep the gut moving. It's going to improve their digestive health. You're going to prevent the colicky episode. You're going to improve actually their ability to go to the washroom without discomfort. And even if your baby doesn't have gas, I want to tell every parent, doing work on the abdomen is so important for overall health, because we've got all kinds of amazing things that are happening in our gut that are even linked to our mental health. That's where a lot of hormones are for our mental health. So digestion is critical. And you can use massage to prevent gas from happening when you start to introduce solids. So it's a powerful, effective, evidence-informed tools that parents can do.
I love this. And you do have a learning academy. So we will put this in the show notes so that anybody watching or listening can actually go there and learn. Because what I love is that you've got these awesome video tutorials that parents can watch and rewatch and actually do it right with their own baby in terms of these different moves that you've got. So
I can be in your living room with you.
That's right. And I've witnessed you, Marg, at different events that we've done together and different baby shows. I have witnessed your magic of getting the fart, getting the poop, the explosions, the burps.
I've filled more diapers. Honest to goodness, I should have shares and Pampers or Huggies, because I am the queen of not only music to the ears of parents, but filling diapers and really earning the trust of these little babies, but then teaching parents that they can do that too. It doesn't have to be just me. And that's why we have our OneLifeAcademy.ca to help. Help is just a click away. Or you can also see me in my clinic or virtually. This is what we love about telemedicine now. If you're really struggling, during the pandemic, Deb, I don't even know if I told you this, I actually helped a family that was referred by somebody I had helped, 10 years ago. And they were on Toronto Island. They're in lockdown, isolation because of COVID, these poor parents, and this baby was screaming like 12 hours a day. So I literally did a telemedicine consultation with them, and through the screen, help them help their baby. By the end of the call, honest to goodness, I posted this. The baby was smiling. Mom was like in tears going, I can't believe this. And the next day I woke up to a text message from the mummy with 10 poop emojis. And she said, success. Thank you.
Awesome.
How cool
This
is that? And I
it's
wasn't even there.
it's really cool. And I think at the end of the day, you and I have always had the same philosophies that we don't want to necessarily always be the one doing these things for you and your baby. We want to
Right.
teach you how to do these things. So there's so much more
100%.
gratification when they can do what you've shown them and get success.
100%. It is. And that's what empowerment is about. That is my role as a preventative health advocate, is really to put you in the driver's seat, and become the CEO of your health and the health of your family. And as moms, we want nothing more than to be able to help um, our babies, and their health and improve their health. So it's really neat to watch. So yes, I'm there to help coach you. And yes, I'm even there to treat your baby, but don't underestimate the power of touch, and quite honestly, your baby loves you the most. And so when you've got that tool that you can use at the ready right here,
Big
it's
one.
incredible to watch.
Amazing. So we've talked about using massage to help with gas and to help poop. What
Yes.
about teething?
Oh my gosh, yes. So teething, every baby is different. And some some babies wake up with a mouthful of teeth and they were quite happy. My children, not so much. I had to work for every tooth coming in their head, and there's all kinds of symptoms and nighttime wakefulness and screaming. It's uncomfortable. Well, massage can be really helpful both intraorally and outside to help relieve pain, reduce inflammation, and bring some relief to teething pain. Coupled, I love integrative medicine, so I always love to couple things. When we talk about gas, I didn't mention this, but I often will say to parents, get Cosentol by Boren Laboratories, world leader in homeopathy, who you can give that to your child along with the massage, and it has incredible results. Same with teething. You can use Camellia by Boren Laboratories. And I got to tell you, I've been thanked so much over the years by thousands of parents who not only learn how to do massage for teething, but then also implement and put in their medicine chest Camellia, and therefore you have success. So a lot of people don't realize that you don't just have to give Advil or Tylenol and just hope for the best. We can play more active role and get our hands on our babies and make a difference naturally.
Oh, right. I agree. And you and I have really promoted these Cosental and Camellia products because they work. And there's so many things
Yes,
on the market nowadays that don't work and they're not the
right.
greatest. So you're right. The Cosental is and the Camellia items that I tell every new parent, you've got to have these on your shelves. And if
Yes,
you weren't able to even get a burp, for those parents who are struggling getting a burp and they can't get that, the Cosental will actually help to release some of that
you
discomfort.
betcha.
So amazing.
Homeopathic medicine is real, and is also based in science. So educate yourself. And if you don't know, reach out. People like myself or people on my team, naturopathic doctors, and that really are here to answer your questions and to inform you so that you can make decisions that are good for your family.
I love that. Can you give us one little hot tip on teething? What parents can do right now if their little ones are struggling?
So take a baby washcloth. You'll get a million of those at baby showers. Wet it, put it around your fingers, and put it in a Ziploc bag and stick it in the freezer. About 10 minutes before you want to use it, you're going to take it out of the freezer and let it soften a bit so you don't have any jagged edges that might cut the baby's gum line. When a tooth is trying to erupt through the gum line, there can be a lot of pain and inflammatory response. Here's what you're going to do, and it's actually the gate control theory of pain, why it works. Just like if you were in labor and you had back labor, you wanted someone. I've been at the birth of over 100 babies giving pain management during labor. I'd have women saying, push harder, harder, and they'd be bruised on their sacrum, but it gives them relief. Well, similarly in the gum line, when you take this semi-frozen washcloth and it becomes a cheap and cheerful massage tool. Now you're going to go inside the baby's mouth. And if this was the gum line, you're going to firmly and circular motion with this cold compress, massage on the front, the top, and the back of the gum line, all along the bottom of the jaw and the upper jaw, regardless of where the tooth is coming in, because it's a bit of a boomerang and the pain can reverberate top to bottom. The massage helps with pain. The cold helps with inflammation. The Camellia is going to help with a lot of the symptoms, and the baby's going to bite down on that. And that pressure is relieving. Now, they may not love it when you first go in, they may resist, but trust me, when you get in there and they start to feel the relief of touch, they're going to let you do it, and it's going to be your go-to thing.
Absolutely. I love that. That's definitely a tip we offer too. Now, something common that most parents think massage is doing is offering relaxation and just general comfort. So maybe you could
Right.
touch a little on that as well, how massage can be worked into your routine if it's just a comfort and just a relaxation tool.
Oh my gosh, it is foundational. I think one thing that COVID has taught all of us, and it's been a bit of a gift, is that failure to thrive in babies, in people through the lack of touch is a real thing. Conversely, the laying on of hands is healing. It has such an impact on every system of the body. Allows us to bond with our children. It allows us to have an opportunity to have sibling bonding and prevent sibling rivalry. I just had a little girl, a 5-year-old, massaging tenderly her little brother in my office yesterday, and watching that interaction through the power of touch. It's incredible. Introducing children at a really young age to massage, which helps them become more aware of their body, where they're holding stress. They tend to communicate about that, and you're laying down a foundation, which is really important. Here's something else that people don't want to think about, but how important it is to start touch really early on. Good, therapeutic, respectful touch. As parents, we don't even want to think about, God forbid, our child being touched inappropriately by someone. When you give massage respectfully to your child on a regular basis at home, you're really showing them what it means to be touched with respect. That allows them to have a voice when, God forbid, and hopefully never, they're touched in a way that's not good. They know the difference, and they're able to speak up. I have seen some incredible things in my 30-year career, and touch never ceases to amaze me. But this is a gift you can give your child that's going to continue to grow. We call it baby massage, but it's a misnomer because it grows with your child into old age. So start to teach them now that being aware of your body, taking care of your body, and having strategies to reduce stress, improve sleep, and just feel good in your body is not a luxury, but actually a necessity for preventative medicine so you can live well.
I love that. And I'm a testament to that because I've heard you and I've watched you every single time you teach a parent, teach a professional, or give a massage yourself to the baby. But the very first thing is you always say, are you ready for your massage?
Can I have your permission? Yeah. Yeah. Can I have your permission?
Can you give us your, I wish I knew then what I know now? What is that one thing that you discovered throughout your motherhood or discovered throughout your career that you're like, God, I wish somebody would have told me 25 years ago?
Wow. There are so many. The first thing that popped into my head is that you are capable, even when you don't think you are as a mother or as a parent. Lean into your tools and trust yourself. Now more than ever, we have access to information, but I think we live in a system, in a society where we're always looking for someone else to fix something for us and a quick fix. And then we're inundated with all kinds of information. I wish I knew many years ago, because it didn't really exist, where there was a village of people that I could lean into, a community that I trusted, that also believed in me as a parent, to give me those tools. And I think that's one of the things and why I love doing work with people like you and all the other professionals we work with, because creating a community of support that's non-judgmental, that's full of great strategy and information, but most importantly, full of empowerment for the parent, is critical. We all feel like we're not capable as a parent, and that never goes away. I've got a 25-year-old and a 19-year-old, and some days I think, what am I doing?
Yes, I can definitely relate with that for sure.
Yeah, so lean in, take a deep breath, lean into the people that you can trust, find your team, and know that you're enough. That's
I love that.
there are many things I wish I knew, but that's one, and I can bring others another time.
Oh yeah, for sure. Well, thank you so much, Margaret. I really appreciate you coming here and sharing all this wealth with everyone. Where can everybody find you? I will put the information in the show notes, but if you can kind of just let us know your website, social media handles, that would be great.
You betcha. So wallisforwellness.com, it is a one-stop health and wellness destination from pregnancy through to palliative care. You will get lost on that website. So go check that out. You can visit our learning academy at onelifeacademy.ca, where you can take courses at the click of your finger and help to improve the health and well-being of you and your family and put you into the driver's seat of your health. On all the social media channels, Wallis for Wellness, FOR Wellness on Facebook, or Wallis #4 Wellness on Instagram. One Life Mom and Baby on Instagram. You can follow me there. You know what? I'm all over Instagram and Facebook and social media, but do reach out. I love to hear from people, and I'm always here to help.
Thank you so much, Margaret. Thanks everyone for listening.
Bye for now.